Hi guys, and welcome back to Health Tips with Tanaka. So on today's nugget we have a new guest. We have Gracious Dzimiri. Hi Gracious.
Hi Tanaka.
Thank you for joining us today. You can introduce yourself to our viewers.
Hello viewers, my name is Gracious Dzimiri. I'm a medical student and I'm coming from the University of Zimbabwe.
Okay, thank you Gracious. So on today's nugget we'll be talking about coronary heart diseases. So maybe to start off, what is coronary heart diseases?
So coronary heart diseases is a broad classification
Okay.
of medical conditions that are related to the heart.
Okay, so what causes coronary heart diseases?
Okay. So coronary heart diseases occurs when there is a reduction in the flow of blood to the heart. So this comes about when there is a plaque that forms in the blood vessels, which we are referring to as our coronary arteries, which bring blood to the heart.
Okay.
So when this happens, our plaque can be as a result of cholesterol or a blood clot. And over time, they result in the hardening and the narrowing of our blood vessels, a condition that we call atherosclerosis.
Okay.
So when this occurs over a very long time, complete occlusion or complete obstruction of our coronary blood vessels can actually occur, which then results in death of the heart muscle cells, or what we call myocardial infarction, or in general terms, heart attack.
Okay, that's good. So what predisposes to coronary heart diseases?
Okay, so what predisposes to coronary heart diseases can be classified into lifestyle-related factors and non-lifestyle-related factors. So by lifestyle-related factors, we mean underlying conditions that come about as a result of how we live our lives and what we eat and what we take in our bodies, and generally how we take care of our bodies, which could result in disease. So for this, we are talking about underlying conditions such as your hypertension, your dyslipidemia, a condition in which we have high cholesterol in the blood, conditions such as diabetes, and other factors also include obesity, your smoking, and the sedentary lifestyle. So these are lifestyle related, or what we can say modifiable risk factors.
Okay, so one thing that I've noticed is that our lifestyle also determines our health, right?
Very true.
So to our viewers, it is important to be mindful of the food that we take in and the way we are going to live our lives.
That is
true. So you can move on.
Okay, so then for our non-lifestyle related factors, these are our non-modifiable factors. For example, we've got people with a high level of an amino acid that we call homocysteine. People with a high level of a clotting protein that is called fibrinogen. So this protein will favor the clumping together of your platelets, and this will result in the formation of clots, which can even occlude or which can block your coronary vessels and result in coronary artery disease. And we also have factors such as your age, your gender, and the family history of coronary heart disease.
Okay, so what are the symptoms of coronary heart diseases?
Okay, so our patients mostly present with angina or chest pain that is related to heart disease. So they can present with a squeezing sensation or a crushing sensation within the chest area. And they can also present with shortness of breath, and they can also present, depending with the stage that this coronary heart disease is at, they can present with a heart attack or myocardial infarction. And in this case, they will then present with a mild to moderate chest pain. They can present with a state of panic, sweating, general discomfort, feeling of dizziness, and other symptoms.
Okay, that's wonderful. So how best can we then help people living with coronary heart diseases?
Okay, so our approach to coronary heart disease is pharmacological and non-pharmacological. By pharmacological, we mean the use of medications that treat the underlying diseases that are predisposing our patient to the coronary heart disease. So we've mentioned our predisposing factors or our risk factors in diseases such as hypertension. So for our hypertensive patient, we are going to give them antihypertensive medication. For our dyslipidemic patient, we are going to give them cholesterol lowering drugs. And then for our diabetic patients, we are going to give them the anti-diabetic medication.
Okay.
So this is the pharmacological approach. So it is tailored to the patient, depending with the underlying condition that is predisposing our patient to coronary heart disease.
Okay.
And then for our non-pharmacological management, we are now focusing on the modification of our lifestyle that will then help us in managing this condition. So now we are now adopting the new start, where we focus on the nutrition, where we emphasize on the importance of exercise, where we talk about water, your sunlight, we talk about rest, the importance of temperance, we talk about air, and the importance of trust in God.
Yes.
So with particular reference to our coronary heart diseases, when we zoom into the diet or the nutrition, we want our patients to eat a diet that is rich in complex carbohydrates and unrefined foods, and a diet that is low in unsaturated fats, for example, that which is found in animal fat. We want our patients, for example, the hypertensive patient, to have a low salt diet. And when we focus on the fats, it's not all fats that are bad. There are fats that are actually good for the heart. For example, our omega-3 fatty acids, which are found, for example, in fish oils. So we want our patients to then consume that, and all our viewers to consume that, because those are good for your heart. And we also then want our patients to take in fruits and vegetables. I'm sure you can elaborate on that one.
So on fruits and vegetables, we can make use of berries. We can also make use of walnuts. And I also learned that fish is important for our heart, isn't it?
Very true.
Okay. All right. That's fine. Thank you, Miss Gracious, for joining us today. So basically today we're learning about coronary heart diseases, the causes, the symptoms, and how best we can help people with coronary heart diseases. But conclusively, I would like to say to our viewers, a good lifestyle, a good health, isn't it? Okay, so thank you so much for joining us. Do have a wonderful day. Goodbye.
Thank you.